Our bodies are incredible machines, constantly working to maintain a delicate balance. One of the most crucial aspects of this balance is fluid regulation. Just like a car needs the right amount of oil to run smoothly, our bodies need the right amount of fluid to function properly. Fluids transport nutrients, regulate temperature, and flush out waste products. When this balance is disrupted, it can lead to a cascade of health problems. Understanding how our bodies manage fluids is essential for maintaining optimal health. In this episode, we'll break down the science behind fluid balance, exploring key concepts like osmolality, osmolarity, and tonicity. We'll delve into the different types of fluids, isotonic, hypertonic, and hypotonic, and their respective roles in maintaining this equilibrium. And of course, we'll tackle the ins and outs of dehydration and overhydration, equipping you with the knowledge to recognize, address, and prevent these conditions. So grab your water bottles, folks, and let's dive into the fascinating world of body fluid balance. Alright, let's break down some essential terminology. First up, we have osmolality and osmolarity. These terms sound similar because they both deal with the concentration of solutes in a solution. Think of it like this. You've got your solvent, which is usually water in our bodies, and then you've got your solutes, which are things like electrolytes, proteins, and other molecules dissolved in that water. Osmolality measures the concentration of these solutes per kilogram of solvent, while osmolarity measures it per liter of solution. Now, for most clinical purposes, these terms are used interchangeably. But remember, the key takeaway here is that both reflect the concentration of stuff dissolved in our body fluids. Next we have tonicity. This refers to the ability of a solution to influence the movement of water across a semi-permeable membrane, like the membranes of our cells. Imagine a cell submerged in a solution. Tonicity tells us whether water will flow into the cell, out of the cell, or remain balanced. This movement of water is driven by the difference in solute concentrations on either side of the membrane, a process called osmosis. Understanding tonicity is crucial because it directly impacts cell volume and function. We'll delve deeper into the implications of tonicity when we discuss different types of fluids in the next section. Now that we've got the basics of osmolality and tonicity down, let's talk about the different types of fluids we encounter in a clinical setting and how they affect our cells. First up, we have isotonic solutions. The word iso means equal, and that's exactly what isotonic solutions are all about. They have the same osmolality as our blood plasma, meaning the concentration of solutes inside and outside the cell is balanced. Think of normal saline or 0.9% sodium chloride solution. When we administer an isotonic solution intravenously, it doesn't cause any net movement of water across cell membranes. It simply increases the fluid volume in the extracellular space, making it an excellent choice for rehydrating patients with fluid loss due to dehydration. Next, we have hypertonic solutions. These solutions have a higher osmolality than our blood plasma, meaning they have a higher concentration of solutes. When a cell is placed in a hypertonic solution, water rushes out of the cell to try and dilute the surrounding environment. This causes the cell to shrink. Hypertonic solutions have their uses. For instance, 3% saline can be used in specific cases of cerebral edema to draw water out of swollen brain cells. However, they need to be administered cautiously, as they can lead to cellular dehydration. Last but not least, we have hypotonic solutions. These solutions have a lower osmolality than our blood plasma, meaning they have a lower concentration of solutes. When a cell is placed in a hypotonic solution, water moves into the cell, causing it to swell. An example of a hypotonic solution is 0.45% saline. Hypotonic solutions are generally avoided for fluid resuscitation as they can cause cells to swell and potentially burst. However, they might be used in specific situations such as treating severe hypernatremia or high sodium levels in the blood. Dehydration occurs when our bodies lose more fluids than we take in. Think of it like a car running low on oil. It can lead to serious problems if not addressed promptly. Common causes of dehydration include inadequate fluid intake, excessive sweating, diarrhea, vomiting, and certain medical conditions like diabetes. Recognizing the signs and symptoms of dehydration is crucial for early intervention. Early signs of dehydration include thirst, dry mouth, fatigue, and decreased urine output. As dehydration progresses, symptoms can become more severe, including dizziness, confusion, rapid heartbeat, and sunken eyes. Treatment for dehydration typically involves replenishing fluids and electrolytes lost. In mild cases, oral rehydration solutions or increased water intake may suffice. However, severe dehydration may require intravenous fluids administered in a hospital setting. While mild dehydration can often be managed with home remedies, more severe cases require medical attention. If you or someone you know experiences any of the following symptoms, seek medical advice promptly. Severe thirst, dark yellow or brown urine, rapid heartbeat, confusion, lack of urination. Remember, it's always better to err on the side of caution when it comes to your health. While anyone can experience dehydration, infants and the elderly are particularly vulnerable. Infants have a higher percentage of body water and a higher metabolic rate, making them more susceptible to fluid loss. They also have a limited ability to communicate thirst, making it essential for caregivers to monitor their hydration closely. The elderly, on the other hand, often experience a decreased sense of thirst, and may have age-related health conditions that increase fluid loss. They may also have mobility limitations that make it difficult to access fluids regularly. Recognizing the signs of dehydration in these populations is crucial. In infants, look for a sunken fontanelle, soft spot on the head, decreased wet diapers and lethargy. In the elderly, watch for confusion, dizziness, and dry mucous membranes. Preventing dehydration in infants and the elderly involves ensuring adequate fluid intake, especially during hot weather or illness. Caregivers should offer fluids regularly and encourage hydration throughout the day. While dehydration is a common concern, it's also possible to have too much of a good thing. Overhydration, also known as water intoxication, occurs when the body takes in more water than it can excrete. This imbalance can dilute electrolytes in the bloodstream, leading to a condition called hyponatremia, or low sodium levels. Hyponatremia can cause a range of symptoms, from mild headache and nausea to more serious complications like seizures and coma. Causes of overhydration include excessive water consumption, kidney disease, and certain medical conditions that affect hormone regulation. Athletes engaging in prolonged, strenuous exercise without adequate electrolyte replenishment are also at risk. Treatment for overhydration typically involves restricting fluid intake and addressing the underlying cause. In severe cases, medical intervention may be necessary to correct electrolyte imbalances and manage symptoms. Maintaining proper hydration is easier than you might think. By incorporating simple habits into your daily routine, you can ensure your body receives the fluids it needs to thrive. Drink before you're thirsty. Don't wait until your body sends you the signal of thirst. By then you're already mildly dehydrated. Make it a habit to sip on water throughout the day. Choose water as your go-to beverage. Water is the best choice for staying hydrated. It's calorie-free, sugar-free, and readily available. Carry a reusable water bottle. Having a water bottle with you serves as a visual reminder to stay hydrated throughout the day. Listen to your body. Pay attention to your body's signals. If you're feeling thirsty, drink up. Monitor your urine color. One of the simplest ways to gauge your hydration level is by observing your urine color. Pale yellow or straw-colored urine generally indicates good hydration, while darker urine may suggest dehydration. If you have any concerns about dehydration or overhydration, don't hesitate to reach out to a healthcare professional. Understanding the intricacies of fluid balance is an ongoing journey. The more you learn about your body and how to maintain its delicate equilibrium, the better equipped you'll be to make informed decisions about your health. Remember, knowledge is power. By staying informed and proactive, you can take control of your well-being and live a healthier, more fulfilling life. Thank you for joining me on this exploration of fluid balance. I hope you found this information valuable and empowering. If you'd like to stay up to date on the latest health insights, tips, and advice, be sure to subscribe to my channel. Together, let's embark on a journey of lifelong learning and embrace the power of knowledge to transform our lives. Don't forget to hit the like button and share this video with your friends and family. Let's spread the word about the importance of fluid balance and empower others to take control of their health.